Hello, Your Health is Lit family. We are back again with the team. Today we're going to be discussing oral health awareness. I'm Donna Williams, the public health queen.
I'm Charlotte Walker, the PDMP, and today we have such a special guest. Yay! So, with us today is Tiffany Grant. She's a dental hygienist, she's a mom, but most importantly, she's my big sister. So, we appreciate having her on today. She's doing some really awesome work in the oral health field, and we are just excited that she's going to share her knowledge with us today. So, for those who don't know, Tiffany, what is a dental hygienist?
So I would say a dental hygienist is, I like to say that we're oral preventive specialists. We're kind of like that that middle level provider in the practice, like commonly in medical, like you have your medical assistant, you have your nurse, you have your doctor. In the dental world, you kind of have your dental assistant, and you have your dental hygienist and the dentist. So
Okay.
that's kind of, we're that mid-level provider.
Okay. And I know that one of the big things that challenge people in dental hygiene is like access to hygiene. What things have you been doing in your practice to help kind of bridge that gap?
So I think like even not only in my practice, but on a state-based level and a national level, I feel like one of my biggest goals is to advocate for hygienists as being an integral part of emerging workforce models that include us to help increase or boost access to affordable dental services, also to reduce negative impact to dental disease in communities. What else? Decrease transitional barriers to oral health care. I think if we were utilized, and that's our highest scope of care, that a lot of the oral health disparities that you see in communities can definitely be reduced. So I feel like that's one of my biggest things that that's what I live to do. So.
And I know that what like community organizations do you participate in?
Like community organizations, well, I am part of a few professional organizations. I'm a part of the American Dental Hygienists Association. At that level, I work with the Leadership Development Committee. I'm also a national delegate for the ADHA. On the more like state level, I'm part of the Missouri Dental Hygienists Association. I'm vice president there. I'm part of the Missouri Coalition of Oral Health. And I work at a FQHC, a community health center. So that's pretty much my associations for the most part.
And you are about to just have you make me feel shame. She's like, and I do this, and I do that, and I do that, and you have all your babies and take care. Like she like does everything. So I know that we have talked, and I know that you've been working on the practice of teledentistry. Can you tell us just
about
that?
So so there's a lot of amazing things that's kind of happening in oral health. I think that oral health is such a crisis in America that people are really seeing the need to address it. We see our emergency rooms lined up with people who have dental issues, and there's not a lot that other medical professionals do for them. We see in a lot of states that they're like the amount of emergency room visits from dental issues, people actually dying because of dental abscesses have made national news as of late. So people are just starting to kind of realize that their head is connected to their body, and we all have to work together to do something about it. So there's a lot of interesting stuff going on nationwide to kind of figure out how to address this oral health crisis. And as a profession, we feel like we are the answer. So like I believe it's important to stress and really encourage hygienists to be innovators and leaders and advocates due to these looming changes in healthcare policy, especially with, a lot of things that were going on with trying to get rid of the Affordable Care Act, which provided oral health, access to oral health to a lot of states and a lot of different people. I know, like, I was part of legislation here in Missouri when we actually got Medicaid dental benefits for adults, and it made a huge difference in emergency room utilization for dental emergencies, which saves the state millions and millions of dollars. Too, so I think that's like one of my biggest things. So teledentistry is a kind of like a emerging model to help kind of increase access to basic and health and oral health services, and to kind of provide a high quality of care at a cost-effective price, and to overall improve population health. We talk about teledentistry, but it's under the umbrella of telehealth. So everyone's doing a little bit of it, in the medical community. So it's using technology to kind of use the mid-level provider at the highest scope of care to transmit information to a doctor or a dentist or a provider in areas where there's low access to those certain providers. So, like, for instance, like the nursing home where we have patients that are, bedbound, they don't have access to get out the nursing home regularly. I would go there, I take pictures, I record things using technology, so the dentist can actually diagnose with the information without actually taking the patient out the nursing home or having to take the dentist out the dentist's office either. So it's a win-win for both parties.
That's awesome. And just for our listeners and people who don't know, so oral hygiene is really important in regards, according to the CDC, African Americans, so non-Hispanic, Blacks, Hispanics, American Indians, we have like the poorest oral health. And as Tiffany stated before, your head is connected to the rest of your body. So I know Donna had some questions for you as well about oral hygiene.
So now that we've learned what a dental hygienist does, what is the importance of oral health, and does it affect more than just your teeth and gums?
So what I would say about that, oral disease and disorders in themselves affect health and well-being of life. So, when you're talking about well-being in life, you're thinking about like quality of life, period. There are significant oral health disparities in various populations, as Charlotte was saying, in the United States. And the crazy thing about what I'm saying is there's many safe and effective measures exist to actually prevent oral disease. Like, oral disease is one of the most preventable disease that you can have, but something like having a cavity is the most common disease, period, in children, but which is totally preventable. What else I would say about that is that I think in order to really attack or address some of these things as far as the impact of oral health on overall health, it takes kind of like changing perceptions, like what you guys are trying to do regarding oral health. So it becomes as an accepted component of general health or overall health, and remove barriers between people and oral services. So I think those are some of the things that we have to be mindful of. And it kind of makes me think of, because you were talking about different populations, social determinants of health, which is like a pillar in public health. There are conditions in which people are born, grow, live, work in, that determines the quality of health or life, or how certain populations suffer to oral health. And so we have to keep that in mind when we're looking at ways to address oral health in communities, and know that this is why they suffer. It's because certain conditions in which they were born and they live and they work in. So, yeah.
I know for us in practice, we I work in a federally qualified health center also. And one thing that I really like is that we have all of the services in one place, because a lot of these parents, like, they catch the bus, they don't have good transportation, they don't have reliable transportation. And so, I had a kiddo when I was doing his oral pharyngeal assessment, he had a cavity so big. I was like, how does your mouth not hurt? Like, what happened inside of your mouth? But I was able to have one of my medical assistants just walk him over to the dentist. Whereas, where I was working in a rural area before, and it wasn't at a federally qualified health center, I would have to, just advise the parent to, please take them to the dentist. This can lead to X, Y, and Z. And then I also know, with our younger kids, we do fluoride applications in the office with their well visits also, just as another way to try to prevent that. And we discuss teeth brushing and the importance of going to the dentist regularly.
So, with that being said, I know that some of the key reasons that people don't visit dentists, the number one is the cost. It's very costly to go to the dentist. And then the next one is actually low perceived need. I think when you're thinking about certain populations, it's do I pay my water bill or do I take care of this tooth? And that's a really easy decision, right? You have to consider that people have a lack of time. People are not willing to take off work to go to a dental visit. It's not something that's really, considering necessity to get into school. You guys, at least, your parents have to get shots. They have to have a physical. They have to have those things. The dental visit's not really necessary. So some states require it, but a lot of places don't require a dental check. Transportation is a big issue. Anxiety. There's out of all the health professions, I think we are the most feared. Difficulty finding dentists that accepts Medicaid and people's actual value of dental care. You probably know too, as well as I know, that a parent would say, well, that's just a baby tooth. Well, I'm well, that's a baby tooth that will be there till they're 13. So they probably still need it because they're 4,
Yeah.
So,
yeah.
So those are things that we're trying to fight against.
So, what are the effects of oral and periodontal disease?
So, kind of just like I was saying, I have a really good quote, and let me see if I can find it.
Okay.
Here. Doling out the cash to get a toothache treated can hurt as much as the tooth itself. Maybe that wasn't the right quote, but I kind of talked about that. I have this graph here where it says life in general is less satisfying due to the condition of the mouth. And when I look at this graph, it makes me understand that there are a lot of physical implications of poor oral health. But as providers, we have to look at the cumulative impact on our patients' social and mental status. I have so many patients that say, I can't get a job because my mouth looks so bad. They think I'm on drugs because the condition of my mouth. I hate to smile because I don't smile because the condition of my mouth. I feel kind of I don't talk to people. I kind of stay away from people. I distance myself from people. They just have poor self-esteem. I was luckily, there was this study of that I was a part of with my FQHC done out of the UMKC, where they looked at quality of life, not just from the physical standpoint, but like how kids were actually impacted. How did they feel like their life was based on their teeth? And they asked questions like, do you get made fun of because of your teeth? Mm-hmm. Do you smile before? Does the condition of your teeth make you sad? And you would be so surprised, those kind of things that don't have like a quantitative number, but more of a qualitative number too, and how it showed that overall that how much of an impact past the physical implications of oral health, how big of an impact were the mental and social implications of poor oral health. It can actually tremendously scar someone, having poor oral health. So, yeah.
I didn't even think of that. Like, when I think of me and, being a nurse practitioner, I'm always like, well, you get an abscess, the abscess sits in your mouth, and then you get septic and you die. Like, then you get septic and you die. Like, but I mean, I have seen patients admitted for a tooth abscess, and they end up having to be admitted and started on IV antibiotics. That costs you way more money than you're going to get that tooth taken care of. So it definitely is.
And just think of all the people who show up in the emergency room and all they can get is palliative treatment.
Yeah.
And so once the antibiotics are done after 2 or 3 weeks, the bubble comes back on their gums and you're back at point A. And so do you continue just getting antibiotics and antibiotics and antibiotics,
Yeah.
So yeah, I mean, and that's where I feel like the importance of dental hygienists are. I mean, that's because especially in rural communities and low income communities, private dentists don't make money there. Our health, the way that our delivery system is completely different than the medical delivery system. There's so much access in a medical delivery system versus a dental delivery system. There's like hundreds of private dentists to one federal qualified health center. Right. And most of the private dentists, they are not taking Medicaid.
Or Medicare. I run into that a lot at work of my patients not having the dental care because they're on a Medicare Advantage plan and they can't find a dentist in their area. So most of them have very poor dental hygiene and not going to the dentist. And then
matter of fact, Medicare on a nationwide basis, Medicare does not cover dental benefits whatsoever. So this is something else that as an organization we advocate for. We've worked with a lot of like senior or elderly organizations to really advocate for dental benefits to be covered under Medicare, especially because we all know as healthcare providers that that's a growing population that want to keep their teeth and they need their teeth, you know? So it's, like people are living longer. They're out there living their best life. So they're actually, they value their teeth because, they want to eat. Like, you don't understand how many people I've seen in a nursing home. They're like, I want to eat corn and cob. Like, I can't eat. I want to eat again, and that's another thing, quality of life. Like, you can't even eat a good, nutritious, like, what if this patient was a diabetic, but it can't eat the right food? They can't eat the right foods because they don't have teeth, Yeah. So, like, these are some of those implications that we're talking about as far as poor oral health goes.
So I know a lot of times we ask, how often should we brush our teeth? How often should we floss? And even myself, I question myself, like, should I floss every day? Should I just floss if I have food in my teeth? Like, when should I floss? So what are the recommendations for flossing and brushing your teeth?
So I think it varies per population. Normally, we recommend that people brush twice a day and floss once a day. But when you're talking about people with health disparities, you have to really customize those things to something that works for them. A routine that works for them things that work for them. So like when I'm particularly talking to that population, I'm kind of like, so how often are you brushing? And how can I get you to increase that? I'm not going to say, hey, you should brush twice a day, because that's probably not going to work. They're probably not going to do that. They have so much going on in their lives, that's just not a priority. So how can I make them see the importance of them, or, give them some kind of instruction that works for their lives? You know what I mean? So I never really, when I'm talking to people who are, homeless, me telling them to brush twice a day, that doesn't mean very much to them. You know what I mean? Or someone who's worried about how they're going to stay in their house. Mm-hmm. Someone who doesn't even have water cut on, you know what I mean? So it's really about like really understanding those determinants, really understanding the patient's barriers to care when you're individualizing those kind of instructions for them. So that's something that ideally, two times a day, and floss once a day, but that's not ideal for everyone. So
I like when you said recognizing those social determinants of health, because oftentimes we don't recognize the social determinants of health, and one person's situation may be different from another person's situation, like the homeless that you use. Whereas a homeless guy going to brush his teeth, he's probably not even thinking about brushing his teeth. He's probably thinking about his last meal. So I think that was a very great point of bringing up.
Okay, so what do you see as the biggest struggles, like in the African American community, when it comes to oral health?
Well, I think like some of those things that I talked about before, perceived value of care. Unfortunately, I would say that's probably the most. Sometimes I feel like African American, it's not that they have access per se, it's just like they just don't value or they're not educated enough on, the value of having good oral health. Like you don't know how many people are surprised when they say that, if you have a systemic disease, like that periodontal disease can antagonize it, you know what I mean? Like if you have periodontal disease, it can raise your blood sugar and make your diabetes uncontrolled. They're like, for real? I'm like, yeah, for real.
Yeah.
So like, they don't understand when I say, when you have gingivitis, that's an inflammatory response that's going on in your body, and it's causing the destruction of your bone and gums. Like they don't understand that that blood that's rotating through your body is pulling all that bacteria out of your mouth and through your body, and it's just making you chronically sicker. And it's funny, I'm going to do something that's easy as clean your teeth, right? Because people think, oh, they just clean teeth. But literally, once I clean your teeth and I get rid of that bacterial load that's under those gums, and your immune system is like, ah, and you start to feel so much better. Yeah. Like just generally, you feel better,
right?
Like everywhere. You know what I mean? You don't feel as sick, and that's one of the most gratifying things that I do. As much as people simplify that, cleaning teeth, it really does make such an impact on the overall health.
Right.
I have patients that come to me and say, "Oh, I just feel so much better after you clean my teeth." Did it suck when I did it? Yeah, but the impact is it's so amazing that something like that can just have such an impact on overall health. So, it's just like it doesn't seem serious enough to lose a tooth.
Right.
I talk to people who just say, I just went and got my teeth pulled. I'm like, what? You need those teeth. Why are you just like getting teeth pulled?
Yes, take them.
You know what I mean?
Them.
Yeah, like I'm like,
because dentures are expensive.
I'm like, yeah, you need those teeth. Not even like dentures, but dentures don't have the full functionality of your actual tooth.
Right.
They don't work the same. They are not the same.
Right.
You know, like it doesn't. It's like you lose almost 67% of functionality in your mouth once you have a denture.
Wow.
Like,
oh my gosh, I didn't know that.
Yeah, I was like 60 to
yeah,
70.
yeah, you're not working with the same set of tools, you know.
Yeah.
Like, so like, I mean, there's nothing like your teeth, you know.
Right.
And people tell me, well, I got these back teeth pulled and now I can't eat on one side, you know. I can't, you know, I don't talk the same. I don't look the same. My teeth are crowding, you know. I can't eat a pork steak. You know, we're from St.
Same.
Louis. Everyone likes pork steaks
Pork
here.
steaks.
And you wouldn't believe how many people I tell people. I'm like, if you get that tooth pulled, no more pork steaks for you. And that actually like really resonates
I'm
with
sitting
them
here like,
because
oh.
it's something it's something about Missouri and pork steaks, you know. Like, so like that's something that they can understand, like, you know. But it's just trying to get them to understand the value of it, you know. Like, there's a lot of parents who don't value the baby teeth.
Yeah.
And their function. They have huge function.
Can you talk a
There's a
little
lot
bit
of
more about that and like educate our listeners that may not know the functionality of baby teeth?
yeah. So baby teeth are placeholders for adult teeth. So once you start to lose them, like for instance, like as the baby tooth is sitting there, the adult tooth is kind of pushing down, uses the baby tooth as a guide to go down into the mouth. So when you lose those guides, you know, that's when you start to get a lot of misalignment. The teeth don't really know where to go. They take longer to come down because they kind of have a working relationship for the adult teeth to even come down into the mouth. So when you lose those too early, then it's like a lost tooth. You know what I mean?
Yeah.
It's not really sure what to do or where to go and when to come out, you know. So they need each other. Not only that, just as far as like kids and the nature of kids, period, like they talk they you know,
Yeah.
as far as self-esteem goes
Yeah.
and people being bullies and things like that, like kids get made fun of. Probably big teeth are probably a big
Yeah.
reason kids get made
Yeah.
fun of,
I
you know
know
what I
for
mean?
me, so like you were there. I lost my teeth, my baby teeth, my front teeth down. I lost them like traumatically. So we were at like a thing on base and this guy threw me a frisbee and my mouth caught it. And so I lost my baby teeth
I'm
traumatically.
sorry.
My teeth grew back in with a gap.
Mm-hmm.
Girl.
Yeah, I know.
Like
And
people really
like I know my husband went through a lot of bullying because his teeth too. I mean, it's just one of those things that kind of can like make or break you and really have a long-term impact on you. Also too, there's a lot of research and studies that show how much kids miss school due to tooth pain. You know, how much poor oral health impacts kids in school, not being able to focus, not being able to pay attention because of tooth pain, because their mouth hurts. They miss school because of tooth pain. Like, we got to do better, you know. We really have to do better, especially because, like I said, I don't know, because in our communities we do have Medicaid providers, probably more than rural communities and urban communities, I would say. And we just don't make it a priority to see them. We almost take it for granted.
Right.
Yeah.
And I know, like I have, when we were talking about education, and I know that plays a big role, which is a lot of the reason why, you know, we started the Your Health is Lit program to promote health literacy, because even in doing the research for, you know, oral hygiene, the CDC also said that adults that are aged 35 to 45 years that have less than a high school education experience untreated tooth decay nearly 3 times that of an adult with at least some college education. So having that literacy and trying to bridge that gap for people who may not have been able to go to college or even finish high school, they're more at risk for like dental decay. I was like, what? Like, what? So the health literacy issue doesn't just, I guess I was a little ignorant to the fact that it doesn't just impact, my patients coming in that don't know how to manage their hypertension, that mom that the kid kept coming in for asthma attacks and she can't read. She can't read the asthma action plan. So she's trying to memorize everything and we can't figure out why, or what's going on. And I just didn't realize how much education also impacted your dental hygiene as well.
Yeah.
Okay. Oh, go ahead. I'm sorry.
And I don't think it's just reading either. I think it's just like how you actually process information, period. Like how you're able to understand basic knowledge, of what's going on in oral health. Like if I tell a patient that they have an abscess, how much do they really understand the severity of that? And that's part of health literacy, you know what I mean? Like, how are they processing what I'm saying to them? I mean, do they really understand? Is that knowledge transferring to them in a way that they understand what I'm trying to say? Not just like if they can read it, but can you understand what I'm saying to you? And that's why, kind of like what Donna was saying, like these social determinants and meeting patients where they are is so important, and like you said, because of education reasons and different things like that, you really have to, and sometimes you can feel like a dental hygienist / social worker, you know what I mean?
Right.
You don't understand how many times, but you really have to delve into these patients' lives to really make an impact in them. And if you don't take the time to do that, then you do them an extreme disservice. You might as well just keep it to yourself. I mean, because you have to take the time to do that. Like, you absolutely do. It should be a standard of care for sure.
Mm-hmm. Yeah. So I mean, I know you kind of already touched on this, but what efforts are being made to make dental services more available, or what things can we do, in our roles, like me, working in pediatrics, or Donna working over the phone as a community health education specialist? What things, within the healthcare system can we do to assist you in providing better education or more thorough health education to these patients?
So, like, one of the things that I really believe in is, like, integration across medical services. Like, I think sometimes, unfortunately, medical providers don't even really value dentistry, to some degree, unfortunately. Like, I know that I was working as part of an integration grant within my federal qualified health center where I was working in primary care practice, but we had so many like nurse practitioners that I would encounter that just did not feel comfortable looking inside a mouth. Like, they just did not want to do it, and that's why I felt like it was important to me to be in practice, because obviously that doesn't bother me. I know how to do it. I'm comfortable to do it. I have the education to do it, but many people are just not comfortable, like, looking in the mouth and taking a look, So I think, like, educating, utilizing people like me more in your practices, especially when you really don't feel comfortable doing it yourself, you're like, I don't know if that's candidiasis or like milk. You know what I mean? I don't.
What is it? Is it thrush?
I'm like, yeah, let me help you. Let me see if it wipes off. No, it doesn't wipe off. You got candidiasis. You know what I mean? They don't even want to put their hand in there. You know what I mean?
Yeah.
It's like, I'm like, you guys do way worse stuff than we do. So, like, I hate when I'm there and they have to get all their quotas done for doing the prostate stuff, and there's bags of poop in the bathroom. So I'm like, hey, you're scared? I'm like, you're scared to look in the mouth and you guys are checking stool? Okay.
Okay.
So,
Yeah. Yeah. That makes no sense.
So, so I just think being more innovative, and I definitely obviously advocate for increased use of dental hygienists to promote access. If you can't do it, we will. So,
Yeah.
also integration, like I said, um, using your workforce efficiently. So that's using hygienists again. There's a let's see here. Um, I don't know. I just think like there's a lot of emerging workforce models that kind of increase access. I do feel like we should do more education and more integrated practices, especially amongst federal qualified health centers.
Yeah.
And even though we're in the same building, doesn't mean we're exactly working together, because like we were connected in federal qualified health centers, and we still had trouble getting referrals like down a hallway. You
What?
know what I mean?
I
Yeah,
love it.
and it happens, unfortunately, just because people won't have the patient open their mouth and look in there and see what's going on. You know what I mean? And like I understand too, because like you guys have like 15-minute appointments, and the person's in there telling you their whole life story.
Wow.
It's really it can be really tough, like
Yeah.
managing that and taking the time to look in the mouth, but
Yeah.
it's just
Yeah.
such a critical thing. You know
I
what I mean?
definitely ask, and I always recommend, like, I always ask when I have a kid, especially if they're well visits, like, when was the last time you went to the dentist? You should be going to the dentist at least every 6 months. We have a dental services down the hallway. Let's make you an appointment. And so I've kind of, even if I don't get in and do a full exam, I do try to make it a part of my spiel to say, have you been to the dentist in the last 6 months? If not, let's go ahead and go, because you don't need X, Y, and Z happening. And I think something that, we're talking about oral health, I know we have not touched on, like oral cancer. Like people do die from like oral cancer. There was according to the CDC, the 5-year survival rate for oral cancer among Black men is a lot less than whites. So Black men, they survive about 36% of the time versus their counterparts, which survive about 61% of the time when they have 5-year survival.
And like there's been this recent kind of like thing with HPV and its relation to oral cancer. And I'm always like, especially my young patients, I'm like, about saying these, really delving into people's life. I'm like, are you drinking? Are you having risky sexual behaviors? Because then I'll send you to your primary care doctor so you can get checked for HPV. Like, yes, absolutely. I say that, and I have those very blunt conversations with them. You know what I mean? Like, because, especially if I see, something in their mouth, that looks like leukoplakia or something, you know what I mean? I'm like, so how often do you drink? How many sexual partners do you have? Like, it's important to really kind of delve into those things. And as far as to what you guys can do, these are some things that I think are drivers for increasing access to oral health. One is that we need to use the workforce more efficiently, like your dental hygienists. I think demographics within our population, within our provider population, we need more diversity in our in the healthcare population, racial, ethnic, health, to kind of address, because we're more familiar with these communities and their needs,
Mm-hmm.
Change in public policy as far as the Affordable Care Act. If you are in public health or health literacy or whatever, you need to be at your state capitol lobbying for your state to have Affordable Care Act or access insurance-wise to oral health or to health access, period.
Right.
Like, you should be there. You should be talking to your congressman. You should be talking to your state representatives. Changes in insurance. We want more people insured by Medicaid. We want insurance through Medicare too. find out more creative ways for people with limited resources to pay, like grants. Write a grant. Like I know our dentist wrote a grant where we would give vouchers to patients who just could not get insured to get dental treatment.
That's awesome.
Got to think outside. Yeah, think outside the box. Changing focus from treatment to disease prevention. You know, that's another. That's two. Like if you're not comfortable looking inside the mouth as a medical provider, let's talk about prevention. You know, let's talk about, have you visited? You can at least ask the question, have you visited your dentist this year? It's really easy. You know, technology such as teledentistry. We have new things like interim therapeutic restorations and silver diamide fluoride. Those are things that we're using to kind of reduce decay, or as a prevention approach. Consumer demand for alternative providers, and I know you guys can definitely understand this battle because you guys fought to be nurse practitioners. We have people that are fighting. We have people, dental hygienists, that are fighting to be like dental therapists and dental practitioners too. So we're advocating for those kind of things. And also too, we have to also think about our population, like generational wise, how they want to receive care, their attitude and behaviors towards care. Like they want it their way right away. They want it to come to them. They want it to be convenient. Right. So a lot of mobile clinics. I work in mobile dentistry because it's very convenient for parents for me to be at a school versus them taking their child out of the school to take them to an appointment.
Right.
Fine. Then I'm there, you know? So I think these are all the things that we kind of need to have in mind, you know, when we're looking at how to increase access and what we all can do to try to increase access. And that too means, you know, when we're advocating for things, that we work together as associations, like the Nurses Association, working with the Dental Hygiene Association. If something comes up threatening funding for our patients, you know, we have to work together.
Right.
Yeah.
Yeah, that's so awesome. We definitely appreciate you coming and just sharing your knowledge. There was so much. I'm sure we could talk about this all day. Like I didn't know that drinking alcohol could cause oral cancer. I was like, that makes sense. I was like, that legit makes sense. Whenever I think of oral cancer, I think of smoking. So just even, you know, having a little bit more of that knowledge for myself. And like I said, I tell my patients too, I was like, now my sister's a dental hygienist and she would not be pleased with me if I didn't ask you if you were going to the dentist, how often you were going, are you brushing your teeth twice? And I tell them, if you're brushing your teeth twice a day, we recommend it. And I have parents go, what? Yeah. And so then I always tell them, I say, you know, all the food that you eat all day, I said, the bacteria wait for you to go to sleep at night, and then they turn up in your mouth, and you get a cavity. And the kids are always like, what? I was like, so unless you want bacteria having a party on your lunch, make sure you brush your teeth in the morning and before bed. So just having those kinds of conversations. So I definitely appreciate you coming on, especially because you're going to have a baby soon. So I know
thank you for having me.
Get you to kind of get you in. So we appreciate your time. And Donna, I don't know if you have anything else to add.
No, it was a good session. I think oral health is something that is not talked about a lot. I know
it's not talked about enough at all.
A big public health issue. So I definitely think that this was a great session, and I actually learned a lot from this session.
Yeah.
So even we are learning with you guys.
Yes. This is why I love this, because we're learning, and I can only imagine, you know, our population and the people that we're trying to reach, how much information this is for them. So we definitely appreciate you coming on and speaking with us, and we look forward to having you on again soon.
Thank you, guys. Thank you for having me.
Absolutely.
Welcome.
Bye-bye.